This video will step you through the model of communication that we're going to use here in PYB007. We'll also talk a little bit about some of the barriers to effective communication. At the end of the video, you should have a nice introduction of what are the different components to a communicated message and what are some of the things that can stop you from communicating your message effectively. At the heart of our model of communication is our message. This is the information that is being communicated in one way or another. One role that we adopt as effective communicators is the role of sender. Senders, as the name suggests, send information to other people. That information may be about yourself, or it may be about something completely different. As a sender, you will think about what you want the other person to know. You'll encode this information into a message that is meaningful, and you'll send that message on its way. You'll use first-person communication skills to send your message. We'll cover these elsewhere, but for now, just think of the sender as adopting a first-person perspective in the communication experience. The next role in our model of communication is that of receiver. Now, when you're in this role, you take in the message that has been sent to you, you decode it to decipher its meaning, and you'll then typically craft a reply based on your understanding of the message. You'll use your second-person skills when you are the receiver. These are all the skills that will help you to encourage other people to share information with you and will allow you to acknowledge that you have heard or received a message that someone is trying to send to you. The third role that we adopt as effective communicators is that of observer. When you are an observer, you are watching over the communication experience while being both the sender and the receiver, and you are objectively assessing your communication to make sure that it's flowing smoothly. You use third-person communication skills as the observer of the communication. These skills will allow you to determine if your message is being received appropriately, if you're the sender, or if you're understanding the sender properly, if you're the receiver. Now, in any one communication experience, you'll move between sender and receiver multiple times. These roles are reciprocal. Now, this makes sense. When you think about your own communication, it's often about moving back and forth between two or more people, all of whom are adopting the different roles discussed in this model. Now, it's also important to consider that your communication will take place within a context, and that context can greatly change the meaning or the understanding that applies to a certain message. Context means the environment or the setting that your communication is taking place in. This can be your home, your workplace, your school, or your university, or it can be somewhere else. The context that you are communicating in will impact on your effectiveness because it can alter the way that messages are sent and received. For example, I'm sure if you were wanting to tell me, your university lecturer, something, you would probably choose different words and adopt a different communication style compared to if you wanted to talk to your friend or family member. Context is not the only thing that can be important on how you send and receive messages. Another thing that influences this is noise. Noise can be both physical and psychological. Physical noise is, as the name suggests, something that you hear that impacts on your capacity to communicate with someone. Maybe there's the noise of some heavy machinery outside the classroom. Maybe a plane flew overhead just as someone said something to you. Physical noise tends to impact on everyone in the conversation at the same time. Psychological noise is less obvious to outsiders. It's more the sort of distractions that you have inside you that maybe others can't hear or pick up on. For example, you might be walking down the street, concentrating on something in your mind, and you don't hear someone call out to you from the other side of the road. Or perhaps you're running late for a bus, and you see it at the bus stop, but you also see someone you know walking towards you. You are nervous about missing the bus, but you don't want to be rude to your friend. Chances are the conversation you have with them will be impacted by you being worried that you're going to miss your bus. So you might miss things that they're saying, or you might not pick up on things accurately. Before we finish discussing this model of communication, let's have a quick look at some of the other barriers that can impact on the effectiveness of your communication. First of all, let's think about language. The language that we choose to use when we're sending a message to someone can greatly influence how well they receive our message. You might assume that the words mean the same thing to all people, but that's not true. For example, based on my experiences in the world, my understanding of the word joy may be quite different to your understanding of that same word. The meaning of words lays within people, not within the words themselves. Sure, words do have objective dictionary definitions. We call this the denotative meaning of a word. But we're not all walking, talking dictionaries, and in many cases our understanding of words is tainted by our own experiences and the context in which we're communicating. Therefore, it's important to realise that words also have a subjective meaning, a meaning that will change from one person to the next. We call this the connotative meaning of a word. If you aren't clear about what your meaning is, you can easily have a misunderstanding between people. Another barrier to effective communication occurs when you filter the messages that you hear. You may not realise it, but you often don't hear 100% of a message, and instead you only hear what you want to hear. Think of someone with low self-esteem. It's a fairly researched and well-known fact that people with low self-esteem tend to filter the messages that they hear to only hear the sorts of things that prove their own negative impressions of themselves. So they hear the negatives and they push away or they don't hear the positives. That's an example of filtering and how it can actually contribute to an ongoing negative misunderstanding about someone's own self-worth. Related to this is the concept of stereotyping. When we adopt negative stereotypes to judge groups of people that we really don't know very much about. These stereotypes are often based on incorrect or biased information, and they don't allow us to form an accurate perception of a situation. This, as you can imagine, can lead to negative and biased communication. Now, I'm sure you've probably been told over the years that you should never interrupt someone when they're talking. In addition to being a socially unacceptable communication behaviour, this is also a sure way to ineffective communication. Not only is it rude to interrupt somebody, but it also sort of sends a message of your words aren't important, or what I have to say is more important than what you have to say. And we don't really want to be sending that message if we can help it. These sorts of messages suggest a lack of respect, and they can lead you to jump to a conclusion about what a person may have been trying to say. Perhaps that jumping to that conclusion wasn't accurate, wasn't true. Effective communicators slow down. They give people the chance to finish what they're saying, and they don't assume or jump to conclusions. Now, it can be tempting when you're communicating to want to offer advice to people. Certainly in the allied health professions, there are quite a number of professions where our clients will come to us specifically because of the advice that we can offer them. And it's considered to be an appropriate and effective way to communicate with clients. But not all of the communication that we're going to have with our clients is offering advice. And in some professions, in fact, it's kind of it's counterintuitive. It's not really what we're supposed to do. For the large majority of students in PYB007, your role will involve helping others to find the answers for themselves. It won't be your job to offer advice. Offering advice is a little bit like telling someone what you think they should do. Some people will want this, but they don't realise that having someone regularly tell them what they should do means they don't learn how to do things for themselves, or how to have what we call a sense of mastery over their environment. Try to limit advice giving if it's not a direct part of your work role. Finally, it's important to briefly point out the differences between hearing and listening, as many communication misunderstandings come from people who think that they are listening, but really they're only hearing. Hearing is what I call the physical component to listening. It's where you use your ears and the other anatomical structures inside your head to actually take the sound waves that have come to you, and you've converted those sound waves into an actual recognizable sound. That's hearing. On the other hand, listening involves a lot more than just your ears. Listening involves your ears, sure, but it also involves your eyes, your brain, your heart. It involves your whole body. It's more of a psychological concept rather than a physical one. To truly listen to someone, you need to be completely switched on and attending to them and working really hard to ignore any other competing sensory information that may be coming into you. Okay, so that's our simple model of communication and the different factors that might influence that communication to make it more or less effective. You should try and remember these concepts because we're going to be applying them and using them in the classes to come.